Hi, this is Ruth King, and this is my presentation on ultrasound for ovarian cysts and other masses. So first of all, what is an ultrasound? An ultrasound is a non-invasive test used to visualize internal structures. The precursors of it were sonar and radar used for underwater locating of structures. So medically, it began as a therapeutic tool, then moved to diagnostic tool in about the 1940s. Uses high frequency sound waves that are sent from a transducer, bounce off something, and come back to the transducer and eventually produce an image. You can see that on the left there is one of the early monitors to show these images, which weren't at first real time. That turned out to start in 1965, and it was for a pelvic ultrasound, the first real time scanner. So we're going to talk about the pelvic ultrasound. We're going to use this to evaluate structures in the genital tract of females or of a fetus if the female is pregnant. So we're going to talk about non-pregnant women. The big players we're looking for here are ovarian cysts, ovarian tumors, tubo-ovarian abscesses, uterine fibroids, uterine cancer, pelvic inflammatory disease, or endometriosis. You can see a picture of a transvaginal ultrasound on the right and a transabdominal ultrasound on the left. So how do we do this, and why do we do this? Pretty good cross-section of the abdomen there to see the main structures we're going to look at. So depending on the structure you want to see, it could last from 5 to 20 minutes. A full bladder is recommended. Patients report no discomfort except for if they have a full bladder. The main contraindication for this test is if the person has a latex allergy and they are using a transvaginal probe. A condom is put on the transvaginal probe in order to aid in insertion. So even then, you just pick a different kind of either condom or cover for the probe, and problem solved. So interfering factors can be air in the bowels, because air does not transmit sound very well. If the woman's undergone barium contrast studies recently, because barium distorts reflective sound waves, or if the bladder was not filled very well, because then you just run the risk of not being able to see the structures and interpret the image correctly. What's our patient presentation? So many women will develop ovarian cysts. In fact, many women have them and never know that they have them, and they never bother them, and they just go away. Most are hormonally associated, and they are benign physiologic cysts that will resolve on their own in 3 months. But there could be other masses, such as a benign ovarian neoplasm. They can get pretty large, or ovarian cancer. The primary presenting symptoms of these masses may be pelvic pain, menstrual disorder, dysmenorrhea, dyspareunia, subfertility, or the woman just could be asymptomatic and they could find a mass during an annual exam. Anyone from puberty on can be at risk for this kind of mass. However, most are benign. It is possible to have cyst before menarche, but it is on the rarer side. So how are we going to find these? Assessment. Palpation using a rectovaginal examination first, and then if a mass is detected with palpation or just suspected because of associated symptoms, then a transvaginal ultrasound is indicated. Okay, so you can see some pictures here of some ultrasounds of ovaries. Top right, normal ovary. You can see some cysts there, probably physiologic. Wouldn't do much about it. Do anything about it. Large cyst on the right. You can see that big black hole. That is quite a large cyst. I don't see the measurements on there, but if it was over 5 millimeters, we would want to further investigate that. Bottom left, loculated cysts. This increases the woman's risk for malignancy. You can see they're getting larger, and they're different sizes as well. So you just want to watch that. And then on the right, hemorrhagic cyst. You can see some fibrin in there. It kind of looks like a spider webby type of texture, and that indicates a hemorrhagic cyst. And then compare those to this next one, which is an actual mass, a tumor, and you can see some vasculature on that's what the colors are, and this is a much more solid picture, and even us who are probably not trained in this can see that difference. So if you saw something like this, you would want to look into it further for sure. Okay. Here's a sample of a scoring system used to evaluate these masses. Surprisingly enough, I could not find just one system to score these masses, but this looked like a pretty good one. So we're going to look at inner wall structure, wall thickness in millimeters, the septa in millimeters, and the echogenicity. So the higher the score, the higher the chance that it could be cancerous. So this is just to help us figure out what we should do next. So sensitivity and specificity of this particular test. So this is referring to detecting malignant ovarian masses. So it has a very high sensitivity. That means an accurate diagnosis of malignancy 89 to 100% of the time for those with a malignant mass. The specificity is also pretty good, although not quite as high. So it should be able to rule out malignancy for those who don't have them 73 to 83% of the time. So if the scoring system indicates a probable malignancy, the positive predictive value is just okay, 37 to 46%. So if there's a probable malignancy, it will be correct 37 to 40%, 46% of the time. The negative predictive value is really, really good on this test. So 96 to 100%. So if it's a benign mass, this is actually correct 96 to 100% of the time. So this is a really, really good reason to use this test, especially since most of these masses are benign. Okay, so cost benefit. A vaginal ultrasound ranges from $150 to $580. This is a pretty good price for this kind of procedure. Laparoscopic surgery, on the other hand, to remove these ovarian cysts range from $7,000 to $10,000. So if we can just take a look and maybe if there may not need to be action required, we definitely want to look at just the vaginal ultrasound or catch it early at least. And the picture up there is an actual picture from a laparoscopic surgery, and you can see the very large cyst on the bottom there. There is a blood test available that is sometimes used to aid in diagnosis, but it actually costs over $200 and it really isn't necessarily indicative of cancer. So it does not seem like most people recommend that now. As far as retesting goes, if the lesion is found to be non-cancerous, it may be unnecessary and stressful even for the woman to be retested. I'll share the guidelines later specifically, but since most of these cysts go away in 3 months, we don't want to cause unnecessary stress. But on the other hand, if malignancy is unclear, we would warrant further testing. So due to the relatively small cost of ultrasonography combined with the non-invasive nature of the test, this really appears to be really more beneficial to use it than to not. So, current recommendations. The Agency for Healthcare Research and Quality recommends, quote, a pelvic ultrasound is the single most effective way of evaluating an ovarian mass with transvaginal ultrasonography being preferable due to its increased sensitivity over transabdominal ultrasound. They go on, if a simple asymptomatic cyst is detected with ultrasound, so we're talking less than 5 centimeters, follow-up treatment really isn't necessary as it will probably go away within 3 menstrual cycles, but cysts over 5 centimeters should have a follow-up ultrasound in a year, or if symptoms develop. Current oncology says transvaginal sonography is recommended as the first-line choice for identification of suspected ovarian masses, and an ultrasonography-based morphology scoring assessment should be done to differentiate between malignant and benign masses. So, discussion. What am I going to do? What should we do about this? Ultrasonography for assessment and diagnosis of ovarian masses is the current standard for initial assessment of ovarian masses after patient. Personally, a standardized scoring system would aid in a more definitive diagnosis. I was kind of surprised, like I said before, that I could not find one single one. Perhaps there's studies out there on these tools. I know sometimes that takes a while to determine ones that are really good and definitive. But it would be great to have some kind of standardized one. So in my practice, I would not hesitate to perform or order an ultrasound on a patient who presents with symptoms that might lead me to consider an ovarian mass. So even for an annual exam, I'd palpate, perform, or order an ultrasound. The cost is low, the risk is minimal to none, and no pain. So especially since most masses are benign, but we can never really rule out that malignancy unless we take a look at it and take a look into it. We still want to do the test if we have any kind of suspicion. For my practice, to learning to conduct this test accurately and to read the image will be a really useful skill to pursue. And the cost of the procedure, if I have my own machine, will decrease if I'm able to do this in house. And be able to differentiate at least those early stages, the simple ones, whether I need to refer or just watch or come back even here. So this would be a really, really useful skill to be able to interpret this test. Here are my references. I hope you enjoyed my presentation and have a great day. Thanks, everyone.